Chances are you have heard about the significance of breastfeeding. But how important is it exactly? Let's discover together. First things first, breast milk that comes for the first few days after delivery is called colostrum. It looks like this, a thick yellowish fluid full of protective elements. Your breast milk is the natural first food for your baby. It is easy to digest and provides all the energy and nutrients that your child requires or needs for the first few months of their life. World Health Organization, that is WHO, has stated that breastfeeding reduces child mortality and has health benefits that extend into adulthood. Breastfeeding protects your child from all infections and chronic diseases, provides the right nutrition for growth and development, and promotes sensory and cognitive development. In fact, exclusive breastfeeding during the first 6 months helps the child fight common childhood illnesses like diarrhea and pneumonia with quicker recovery. Children who breastfeed longer tend to have higher IQ and are protected against obesity and adult diseases like diabetes, cancer, and heart diseases. So now that we have covered how breastfeeding is so good for your baby, now let's see how breastfeeding is actually better for you and your health. It reduces post-delivery bleeding, the risk of ovarian cancer, breast cancer, and type 2 diabetes, and helps you space your children. Breastfeeding also enhances the emotional bond between you and your child. So what is the most natural way for feeding your child? Yes, you guessed it right, breastfeeding. It is safe for the environment, safe for you and your child, as well as society at large. You know, breastfeeding is really important for your baby. But did you know that breastfeeding should be initiated immediately after birth, preferably within the first hour of birth? This part of feeding is called early initiation. The first milk after delivery is called colostrum, which is rich in anti-infective factors like antibodies and vitamin A. It protects your baby from infections, builds immunity, and promotes baby's growth. Whether you had a normal delivery or you had a C-section, it is always best that your baby be kept on your bare chest right after birth. This process is called skin-to-skin contact, or we can call it SSC. Your baby is very alert and responsive in the first 1 or 2 hours after delivery, which is why suckling and attaching to the breast becomes easier for the baby. So you see, SSC helps the baby with early initiation of breastfeeding. SSC also releases oxytocin, which helps both you and your child feel calm and relaxed, promoting bonding between the two of you. It helps your baby maintain and regulate body temperature, breathing, heart rate, and blood sugar levels. It also reduces the chances of postpartum hemorrhage as well as maternal stress and postpartum depression for you. Now you see, you must opt for early initiation and SSC for your and your baby's well-being. You can discuss your options with your gynecologist during your antenatal appointments. It is the best that you inform your doctor about your choice to go for SSC, which will definitely help them prepare for it in the best way possible. You can also ask for your husband or any other family member to be present with you during labor as a birth companion. So how can you ensure your child's physical and mental well-being? Yes, you guessed it, skin-to-skin contact, which leads to early initiation of breastfeeding. Both these things in combination help the baby in healthy weight gain and growth, leading to a healthy, thriving child. You know, breastfeeding is the most natural food for your baby. But how can you as a mother help your baby breastfeed successfully? Come, let's see how you can position your baby the best way, be it after natural vaginal delivery or C-section, so that he or she can attach successfully with the breast. Remember, you can feed your baby the way you feel most comfortable. be it sideways or sitting. The one more important thing to note here is that your baby should have free access to your breast. Here is a step-by-step guide for you. Support and hold your baby close in a way where the baby's head is held straight facing your breast. Please note, you must hold your baby's whole body and not just the neck and shoulder. Your nipple should be touching your baby's mouth. Wait for your baby to open his or her mouth. Once they do that, offer the whole breast to your baby. These are the signs of good attachment. Your baby's chin should be touching your breast. Mouth should be wide open. Lower lip should be turned outward. More areola should be visible above the baby's mouth than below, and there should be no pain. Now, in case you have a C-section, you can breastfeed as soon as possible once you regain consciousness. Come, let's see some tips on how to position your baby if you have a C-section. You can lie on your back with your baby on top, like this. Or you can lie on your side with your baby beside you, like this. You can also sit after some time holding your baby like this. However you position yourself, make sure that your baby is facing your breast so that he or she can attach well. You can ask your husband or any other family member to be present during labor and delivery. They can help you out with the first breastfeeding. You can also ask your doctor or nurse to support you during this. Make sure that your baby is immediately brought to you to hold for skin-to-skin contact, or we can call SSC, and early initiation. So how do you feed your baby? You guessed it, sitting, sideways, or any way that you feel comfortable. Remember to look for signs of good attachment, and you and your baby are ready to feed. You are aware that breastfeeding is the most natural way to feed your baby. But what if due to one thing or another you are unable to breastfeed your baby? Like if you are sick or you have to go to an important office meeting. How do you make sure that your baby is well fed in such a situation? Well, the answer is simple. Expressed milk. You can use your own hands to express your breast milk. Let's find out what the correct way to express milk is, step by step. You should start by washing your hands thoroughly with soap and water. Clean the cup or utensil you will express your breast milk in by washing it with soap. Sterilize it by rinsing it with boiling water. Now for the next steps, place your thumb on your breast above the nipple and areola such that your first finger is below the nipple and areola, just opposite the thumb. You can support the breast with your other fingers. Now start gently pressing your thumb and first finger inwards towards the chest wall. Repeat the motion of press and release. Press and release. Be gentle. This way, you can use your hands to express your breast milk. Please remember, this expressed breast milk should be stored at room temperature for 6 to 8 hours and up to 24 hours if refrigerated. You or the carer of your baby can feed your baby this expressed milk using a clean spoon from the cup. Expressed breast milk is useful in different situations, especially to feed a low birth weight or sick baby who is unable to breastfeed. Milk expression can also relieve from breast conditions like engorgement. It helps maintain the milk supply when you are ill. It can also help relieve leaking breasts. You can leave the expressed milk for your baby when you go out to work. You can also feed your baby like this while he or she learns suckling from the inverted nipples. So do you need to worry if your baby is not breastfeeding directly? You guessed it. No way. Expressed breast milk is here to save the day. After all, your baby needs all the nutrition it can get from your breast milk.
Kangaroo mother care includes continuous skin-to-skin contact between a mother and a baby, held securely in a sling or wrap for as many hours in a day as possible, and exclusive breastfeeding. WHO recommends kangaroo mother care as the essential standard of care for all preterm or small babies, both well and sick, starting immediately after birth. It has been shown to save lives, reducing infections and hypothermia, and improving feeding. It provides immense benefits compared with the common current practice, whereby small or preterm newborns that require specialized medical care are separated from their mothers and caregivers inside a newborn care unit. So here is how you can help ensure every small and preterm baby gets the skin-to-skin contact they need from the moment they are born. Mothers can provide kangaroo mother care for their babies starting immediately after birth. Fathers, partners and family members can provide help and relief, stepping in when mom needs rest.